Awesome. Good morning, folks. My name's Jody. I use she, her, or she, they pronouns with the Coalition on Homelessness. We are really happy you're here. I am expecting that we will see more folks kind of trickle in this morning. As I mentioned earlier, I know there was some bad accidents up in the north of Seattle. The Healthcare for the Homeless Network is having their annual gathering, and there was another big conference that we typically go to. So we might be just a little bit intimate today, and we kind of like intimate here at the Coalition. So I think I recognize a lot of these names that are in the room right now with us. So glad you're here. Please feel free to introduce yourself, pronouns, agency, or how you're connected to the Coalition or this work in the chat. We do record these meetings. We'll have a nice blog up and the video on our YouTube pretty quickly after the meeting. This is our October general membership meeting. We're going to give you links a couple times throughout the meeting here for our November meeting, where we're going to have the King County Veterans Program here, and then our December legislative preview meeting, which is always a big extended 2-hour special meeting. We're also having that a week earlier. So instead of the third Thursday of the month, we're going to do it on the second Thursday of the month, which I believe is December 14th. So we just want to flag that for all y'all. And, this is where we have a lot of our advocacy partners come in and talk about their legislative preview and what their priorities are. We have electeds come and share some of the work that they've done previously that's carrying forward, or things that they're also going to be focusing on in this coming legislative session. So we encourage you to show up to both of those meetings, because they will be packed with a lot of information. Rachel, thank you for sharing this agenda. So we are really excited to have Cassidy Thorne from Disability Empowerment Center. This is a really peer-focused, largely peer-run organization here locally that provides a ton of different services, from like job employment and housing referrals and transportation and support for independent living for folks that are living with a disability. And we know that folks experiencing homelessness disproportionately are also have a disability that they are living with. So we are really excited to have her here. We're going to do a little highlight about some of the Medicaid enrollment terminations that we've been trying to just, raise for folks since the ending of the public health emergency. Hallie and Allison are going to talk a lot about Seattle and King County budget. And then we're going to do some community updates and member announcements. So that is our day for you. So if one of you would lovingly come off mute and read our mission, vision, and values, that would be lovely.
And that's an open invitation to the participants in this meeting to engage. If you've never done it before, Rachel just put up the slide that shares our mission, vision, and values, and you're welcome to join us in doing this. It's a way we ground ourselves every month in what our purpose is in getting together here through the Coalition.
I don't mind reading it out loud.
Thank you.
No worries. It says the mission is that we mobilize our community to challenge systematic causes of homelessness and advocate for housing justice. The vision is a region that acts on a shared sense of responsibility to ensure that everyone has a home. And our values are equity, justice, collective action.
Thank you so much.
No worries.
Appreciate that. And glad to see you're with the crew over at CCS. I used to work very closely with that team when I was at Healthcare for the Homeless. So glad you're here. Welcome. Thank you for the person that enabled closed captioning. I forgot to mention that is an ability. You are always welcome to come on camera. We love seeing faces. You can also change your name in your little Zoom box. But on that note, I'm going to pass it to my colleague, Tim, to really start talking about our program spotlight today. So take it away, Tim.
Awesome. Thank you so much. I have been lucky enough to work in the field during some of our voting registration work to meet some wonderful people from Disability Empowerment Center. It does look like their name is Cassidy Thorne. They're a fantastic programs manager. It does look like they're having a few technical issues at the moment. So I think we are going to have them join a little bit later in our broadcast. However, let the anticipation build. They're going to share awesome things about access to inclusive services for people with disabilities, people who want to maintain autonomy and independence while gaining accommodations to live a fulfilling life that could be relevant for some of your clients. So we'll hear from Cassidy, I think, a little bit later.
Awesome. Thank you, Tim. And Cassidy, so sorry that you are struggling with your video, but that is the world of Zoom and we will roll with it. So Apple Medicaid enrollment terminations. We've talked about this a couple different times in our general membership meetings. We've mentioned it at some of our public benefits or key trainings. And we just want to keep raising this issue up for folks and sharing this information out because we are seeing really high numbers of folks that are getting terminated and dropped from their Medicaid. And this is a result of the public health emergency that ended. So through pandemic, through COVID years, the state could not unenroll folks and drop them from their Medicaid. So people were just automatically renewed and they didn't really have to do anything to maintain their Medicaid benefits. But starting on June 1st of this year, so backtrack, 5 months or whatever, the state started removing folks from Medicaid who no longer qualified. So this is the first time in about 3 years that people have had to sort of like either provide their eligibility or if they're no longer eligible, find alternative coverage. So how the state has been doing this is by mail, not surprising. So notices are being sent out every month and they're usually on the anniversary of when someone enrolled. So this is like, just think of a large rolling wave of notices going out. And as we know, a lot of the folks that we are working with, access to mail or consistent mail or, a consistent mailing address can be a pretty big challenge, or getting to that place where they get their mail can be, with long time in between. So we are just wanting to make sure that folks really know what to do and how to do so they can maintain their coverage or get back on their coverage pretty quickly. So as I mentioned, renewal notices are going out every month. Folks do have 90 days from the time of their renewal to when they receive that renewal letter to provide their eligibility information. If it passes, they can still kind of challenge it and get re-enrolled. But so we have a lot of links that we're going to share with you that are just really good, easy, quick information, FAQs, things that can be posted in your community spaces, your workspaces that you can share with folks. The one I really want to highlight to you all is King County's Department of Community and Human Services, DCHS, tends to do, that link didn't work. Okay, someone will help me. But they did a really lovely blog breaking this down in really plain language, which if you've ever been on like the Washington Healthcare Authority site or DSHS, it's not always as straightforward. It can be a little confusing. They did a really beautiful job of breaking down this information. And then they have some visual flyers in, I want to say like 6 or 7 languages. So English, Spanish, Chinese, Korean, Russian, Somali, Punjabi. I might have missed one. that just basically say, help folks make sure that their contact information is up to date, where to go to do that, where to go to renew or provide that coverage. So we just want to keep putting this up, back up on folks' radar. And then the Northwest Health Law Advocates is a civil legal aid organization that's really tracking this and is pretty astonished by the high numbers of folks that are getting unenrolled. And this is how people are getting their physical and behavioral health needs met. So we want to make sure people have that coverage and can continue to stay healthy. So the Northwest Health Law Advocates are a great resource if you have further questions or you're seeing issues. They would be a great place to reach out and flag this for. So that's great. I think what we will do is we're going to move on to our budget and advocacy, King County and Seattle budget advocacy. So Allison and Hallie, I'm going to turn it over to you.
Thanks, Jody. I can start us off with just some updates of what we've been up to. So we had hosted a phone bank for the Seattle Housing Levy earlier this week. It was a great success. We called about 270 likely voters. And we had folks from Youth Care, DESC, the Housing Development Consortium, and others show up. And just wanted to give a special shout out to SMR Architects. They hosted us in their lovely office space, and to Chad from the Housing Development Consortium, who came and trained volunteers and hung out with us and made calls. He also took a fabulous selfie with all of us that I'll add to the chat if you want to see a goofy selfie of all of us at the phone bank. In full candor, this was my first phone bank. I was very scared to like call people who I don't know. And it was totally fine. So if anybody else out there is sort of on the fence of like, ugh, I really don't know if this is for me, it was actually a really fun experience and good to be, in community with like-minded people and, get the word out about this really, really important levy. So we have a sign-up form, if one of my colleagues could drop that in the chat, for folks to use if you're interested in future phone banks. We're expecting the campaign, the Yes for Homes campaign, to post some upcoming phone banks soon. So you can go ahead and use that interest form to let us know if you're interested, and then we'll reach out to you when the official sign up is available for those. Allison, did you want to say anything else about phone banks?
Well, I think I might just say a little something about the housing levy, because one of the things that we're trained to do when we call prospective voters is, if you're lucky enough to get a person and not just be leaving a voicemail, is to ask if the person on the other end of the phone is familiar with the Seattle Housing Levy. And so I think I'm just going to ask that question here, and you can raise your hands if you have heard of the Seattle Housing Levy. We recognize plenty of folks at the coalition haven't necessarily don't necessarily live and vote in Seattle. We are a county-wide entity and people are here from all over, but let's just have a quick show of hands or whatever symbol you want to use. Okay, Karina, yes, that doesn't shock me. Thank you. Jody, right? Okay, so I'm going to tell you just a little bit about the Seattle Housing Levy, because there's a reason why we are taking our time and that of our members to push to pass this levy. This is a once every 7 years levy. In fact, the Seattle Housing Levy is one of the original housing levies. You all might have heard about or be familiar with advocating for our state housing trust fund. to be increased every biennium because we need that money. It's not truly a trust fund. We need that money invested at the state level. Well, guess what? The State Housing Trust Fund is based on the Seattle Housing Levy. The housing levy is the OG resource. And this is probably the 5th year. The levy has been around for 40 years. So this is the 5th renewal. And in those 40 years, voters voting to tax themselves, it is a property tax levy, which we know property owners pay as well as renters in the form of their rent, has created or rehabbed 12,000 affordable homes, with a really strong emphasis on homes for people at the very lowest end of the income spectrum. And right now, 16,000 people in Seattle live in levy-funded homes. That includes every single permanent supportive housing building that exists in the city of Seattle, as well as many other wonderful programs and projects all around the city. Should we have a version of that at the county? Wouldn't that be an interesting idea? So even if you're not a Seattle voter, I think it's worth paying attention to this. The other thing is we, the coalition, has been part of a group that has actually been active for the last 18 months, knowing that the levy needs to be renewed, to push for what this package going to the voters right now is going to include. This is a $970 million over 7 years housing levy. Part of the reason that it is large, close to $1 billion over 7 years, is because the cost of building buildings has increased so much. And part of the reason it's large is because we need to continue to provide maintenance and have services in all the buildings that have been built before. So this really is something that has to grow. The other thing that I want you all to know about this housing levy is super exciting. It is a result of our and others' advocacy for the people who do this work. So the phone bank that Hallie put together, her first ever phone bank on Tuesday of this week, was called our Essential Workers Say Yes for Homes phone bank. And it was specifically designed for folks who do this work. We had frontline staff, we had residential counselors, we had an architect, we had advocacy folks from a number of organizations, as Hallie said. And these are the people who understand why we also need to be investing in the direct services staff, the folks who help people once they are fortunate enough to be in housing, to help make it home. So this is an investment, and really we have gotten to the point where the mayor and the city council are all articulating this as essential. It is an investment to raise the wages of the people who work in permanent supportive housing. So I want you all to just be aware of that as you're hearing about the housing levy. And even if you're not a Seattle voter, it's really worth checking it out and talking to folks about why this is such an important investment and how, of course, we need to do more. There are other parts of the levy that include rent assistance and help for folks who would, in the competitive marketplace, normally not have an opportunity to own their own homes. So there are other things that are very important that happen as part of this levy renewal. But it's one of the things that we actually want people to get excited about, not just feel like, oh, I guess I'm going to say yes. So anybody have any questions about that? Okay, great. We really do encourage you. We're also going to be helping folks do, I'm using my thumbs here, do text banking, because we recognize for a lot of people making phone calls is absolutely not what you want to do. Even though I had several lovely conversations with people, I am always amazed, but if you're friendly and polite, people are willing to talk to you. One woman gave me her mom's phone number to call her about the housing levy. And I called her, and she's a voter, and she said, yes, I'm going to support this. So, but we'll also have text banking as an opportunity. And The other thing that we think is pretty great about this is not doxing, not doxing. There has to be a better word, Karina. But the other thing that's great about this is, you know, we got to come together in person. And every time we do that these days, I just feel so delighted at getting to meet people. Hallie made fabulous homemade molasses cookies. We met somebody who brought her little dog and who shared you know, some great examples of the work that she does at DESC, and it just really was a very lively opportunity. So that's the end of our pitch, but reach out if you have an interest in supporting this, because it also feels great to be part of what I hope will be a historic renewal of this important investment. And now I think we're shifting to talk about the Seattle and King County budgets. Is that right? Okay, back to you, Hallie. Thank you.
Sounds good. So I'll start.
Actually,
sorry,
Hallie,
go ahead.
can I interrupt you? I think we wanted to, while we were talking about things on the ballot, remind folks about a little bit of voter stuff coming your way. So Tim, do you want to take it away here?
Yeah. So it's not just the Seattle Housing Levy. That is a very important measure for people who live in the city of Seattle. But there are races all over the county that affect city councils, school board makeups, special districts, so many things to vote on November 7th. And I just got my text message the other day stating that my ballot is on the way. Very exciting. Everybody, I would say at this point, if you're already registered and everyone you know is registered, keep an eye out for your ballot. If you know people who are not registered, especially people with lived experience that want to share their voice in making things come through in their community, the registration deadline for doing it online or via mail is on the 30th. So a person still has time. If you're mailing in a registration form, obviously you want to do it a couple days before the 30th so they can receive it by then. Yeah, make sure to share that opportunity. If you've already registered and have not received your ballot, you can also print your ballot at your home or local library or anywhere you have access to an internet connection and printer. We definitely want to share that resource. And I have a bunch of links to share. If anybody can share those, thank you very much. A reminder that in King County, for those who either have registered or who have not registered, you can still register and access your ballot on the same day up to Election Day. So up until 8 p.m. at a vote center on Election Day on November 7th, you can register, print your ballot, submit it, and have your vote counted for all of the races that you would like. And then we just encourage people to contact King County Elections. They are a responsive agency. We partner with them. We're proud to partner with them. Please give them a call if you have any questions about your ballot, if you haven't received your ballot, or if you just want to chat about voting. I'm sure they would do that with you too. So yeah, any questions at all about voting? Speaking of this, we have materials for events. If you are a service provider or a program agent or just want to share information with your community members, we have lots of printable flyers on how to register, how to submit your ballot, tips for new voters and returning voters. I'm going to put my email in the chat if anybody needs any materials to help us get out the vote. And now let's move on to budget advocacy.
Thanks, Tim. That's super, super important information. So jumping to our work on budget advocacy, both of the Seattle and King County budgets have now been, proposed budgets have been released. Seattle City Council has been working on the Seattle budget for a few weeks now. King County will have its first budget meeting coming up on the 25th of this month. So King County is on a little later timeline than Seattle is. just to remind folks of our priorities going into this budget season at both Seattle and King County, our priorities were to get 7.5% inflation adjustments for homelessness service provider contracts, 3.5% wage increases for homelessness services providers. And that's in line with a study that came out of UW that really showed how dramatically underpaid human services providers are in King County, and how really the very minimum that we need to do to keep people in the sector is to provide a 7% wage increase over the next 2 years. So splitting that in half, we get 3.5% this year, 3.5% next year. That's how we got to that 3.5% mark. And finally, full funding and adjustments for programs on fiscal cliffs that had been funded year over year over year on one-time funding. And so some good news from Seattle, we got the 7.5% inflation adjustment that is required by City of Seattle law. There was also included in the mayor's proposed budget a 2% wage adjustment, which is good, but of course not enough. And there's also provided for level funding for those programs that were on fiscal cliffs. So those programs will have enough funding to receive the same funding that they got last year, but are missing that 7.5% inflation adjustment and 2% wage adjustment. So the things that we're advocating for in Seattle right now are to get everybody, all of those contracts, up to that 7.5% inflation adjustment plus the wage adjustment, and of course fighting for a larger wage adjustment beyond the 2% that's included in the mayor's proposed budget. Another thing I should highlight is continuum of care contracts that used to be held by Seattle that have now migrated over to the King County Regional Homelessness Authority. Those are not receiving that 7.5% or 2% wage adjustment at this time. So that's another thing that we are laser focused on, is making sure that Seattle provides funding for that, because just a couple years ago when those contracts lived at the city, they would have been legally required to get that inflation adjustment. So we really don't want homelessness services providers to be punished based on like what government agency their contract lives in. That doesn't really make any sense for anybody or for the system. So those are really our focuses in Seattle. The King County budget came out a little bit later, so we're still sort of wading through that and figuring out where we really need to push on the King County budget. King County is really looking at some pretty ugly budget cuts this year and next year. So far what we know of their mid-biennial budget. So King County passes a 2-year budget. They did that last year. So what they're doing this year really is only just making adjustments to that 2-year budget. So last year there was some funding included in that 2-year budget for contract enhancements, so additional money for those human services contracts. And what we're working on understanding right now is how is that distributed over the 2 years, and what do we really need to push on to get everybody up to be able to compete with inflation for this coming year. So more to come on the King County budget. And if I could have one of my colleagues drop the link in the chat to our budget site, thank you. We are keeping tabs on both the Seattle and the King County budget on this site. You can also find a schedule of public comment opportunities, as well as all sorts of resources to give public comment. We're really trying to make this a one-stop shop for all things budget and budget advocacy. Allison, did you want to jump in before I go into like the schedule of public comment?
I do. Thank you so much, Hallie. Yep, just a little bit. So for some of you who've been around through several Seattle and King County budget advocacy cycles, you might be wondering, why is the Coalition on Homelessness not advocating for more shelter and more housing? Because obviously we need those things. So, and I just saw a message with staff. Tim, I'm going to ask you and Jody to problem solve in the background while Hallie and I continue. Yeah, thank you. Good thing we have so many people on our team. So you might be wondering, as are we, why are we not actually advocating for what people need? Why are we just doing this kind of like fixing levels of funding? And I'm going to share the truth with you, which is not making me very happy, but it's real. This is the second year of a biennial budget. So one of the things I learned when I came to work at the Coalition is the word biennial. I only knew about it with respect to plants. But actually a biennial budget is a common thing in local and state government. Seattle and King County, and actually our state legislature, pass 2-year budgets at a time. And that means that most of the work to create the budget happened last year. This is a 2023-2024 budget, and therefore there's very little room to change anything. That's one reason. Another, and it sort of makes sense because it's a huge amount of work to create a budget, and there is some value to having continuity. But it also means that things like trying to get a 7% wage increase for human service workers over 2 years gets super complicated, because city council members and county council members can't take action this year that's going to affect 2025. They can only take action that affects 2024. So that's one challenge, because we know that we need to do things that build over time. The other reason is politics. 7 of the city council positions in Seattle are up for election. Whatever you think of the various candidates, new and incumbent, that means a massive change is coming to our city council. And it means that there is not a huge appetite to do significant things. It takes a lot of political will, and it takes a minimum of 4 other council members agreeing with you, and probably 5 so that you could overcome a veto. So it means there's not a lot of movement. That's the reality that we're operating in. Here's another more positive way to take a look at it. Again, if you haven't been around advocating with us for a while, you might not be familiar with us, but I want to be clear. The only reason that contracts through the Seattle Human Services Department are required by law to increase according to inflation is because of our advocacy. We brought that idea forward. We worked on it for years. We worked with Seattle City Council members, Teresa Mosqueda, Lisa Herbold, and others to draft that ordinance. We filled City Hall chambers before COVID to demonstrate that we expected every member of the City Council to pass that ordinance. And every member of the Seattle City Council at that time, including current Mayor Bruce Harrell, voted yes. It was unanimous. So last year, when now the mayor, Bruce Harrell, put forward a budget and didn't follow that law, we organized the heck out of this community. The Coalition on Homelessness, the Coalition Ending Gender-Based Violence, the Seattle Human Services Coalition, and the labor unions that represent many of our members, SEIU 1199 Northwest, OPEIU Local 8, and the Martin Luther King County Labor Council showed up and rallied and gave public comment. And guess what? Not only did we get the law followed, but this year when Mayor Harrell proposed the budget, he didn't try that. So if you're feeling disheartened, which we all have many reasons to feel, I want to remind you that we do sometimes make progress more incrementally than we would like, more incrementally than people who need homes need. But we also try to keep building towards what we know is necessary. And this year, because of the elections, because it's the second year of a biennial budget, and because the housing levy is on the ballot, that's the other reason, this is what we're advocating for. Now, we have been talking about the possibility of advocating for additional shelter resources, not only in Seattle, but in King County and at the state level. So when Hallie is about to share with you the opportunities for you to speak up, I want to gently suggest to you, it's not optional. If you take the time to come to a coalition meeting, and this is an unusually intimate one, as Jody said, we thank you and we remind you, this is a coalition of people who are interested in making change happen. And one of the ways to do that is to advocate during the budget process and use whatever your personal and professional knowledge is to tell elected officials what they need to know to do their jobs. You are doing them a favor. And we aim to make it as easy as possible. And we are here to answer questions and hold your hand and help you think about what your public comment might be. We are going to create an action alert. So lots of you have signed up for our email templates, and we're going to create an action alert and we're going to ask you to take action. But we're at a funny point in the process where we literally have a meeting this afternoon with the Seattle City Council Budget Chair, Teresa Mosqueda. And I've got a conversation later on today around the King County budget. So we're still fine-tuning what the messages are. And we're going to invite you to help us make our voices heard. Is there anybody here who's like never sent an email, never signed up to give public comment, never had a chance to reach out to an elected official who represents them, who might be brave enough to just share the fact that you've never done that before? You could just come off mute or raise your hand or put something in the chat.
I'll put myself on blast. I've never given comment before.
Okay.
I will let you know that outside of my work life, I also am part of an organization that fights for national improved Medicare for all. And we, connect healthcare, housing, education, nutrition, all of those things together. So I have met with congressional members, but I've never contacted any sort of local city council or anything like that before.
Wow. Elizabeth, thank you so much. Awesome. You are going to take what you know from having met with members of Congress and organizing on a national level, and you can integrate that into your written or spoken public comment, and we would be honored to support you in doing that if you wish. One of the things Hallie's about to share with you all is sort of like a clinic idea that we have tested out last year. So thank you so much, Elizabeth, because I bet you're not the only person. And really the whole point is, great, we have a fresh voice. And for those of you who have done it before, please share your experience. It's really, we live in a society that is a representative democracy. And some people sort of question that. And what I say in response is, it's up to us to actually make democracy work. It is a process. It is a live engagement opportunity. It is, as one of our favorite coalition slogans goes, democracy is not a spectator sport. But it can feel intimidating. It can feel obscure. The processes can be complex. The language used can feel unfamiliar. Don't worry about it. We will help you. It is truly our mission as an organization to lift up your voices and those of the people you work with. And anytime we do this, we learn and we are touched by the ways in which people talk about the necessity of providing good shelter, good housing, good services, as part of our democratic process. So those of you who are really experienced, we're going to call on you too. And I'm going to just let Hallie share with you the many different ways. And I guess the last thing I'll just mention is pick what works for you. If you're willing to speak, over the phone or in person, great. If that doesn't seem accessible to you, customize your email and show other people how to do it. It's whatever works for you and that you're going to do every time we ask you. Because remember, we're the advocates for our folks. Other entities, like the business associations, hire people in suits by the dozens to lobby for them. We are the lobbyists for people who are homeless, unstably housed, need Medicare, need Medicaid. Okay, great. I'm passing it back to Hallie, and it sounds like Tim and Jody have solved our presentation issue. So thanks for letting me babble on about democracy.
Thanks, Allison. And I'll share too that I was new to giving public comment until I got this job. So I am right here learning alongside with you. And so we will be hosting a couple of public comment clinics on Teams. And those are really just sort of office hours that you can come and get help with giving public comment. You can ask questions. You can work with us to write your public comment. It's really whatever you need. We have a lot of resources posted both in the budget advocacy site that Allison just posted in the chat. And also I have sample script that I can share with you. There's a lot of resources that we can use to support you in either giving public comment, either remotely, in person, or in writing, or engaging in other ways, like through an action alert that Allison mentioned. So those public comment clinics are going to be before the next two opportunities at Seattle City Council to give public comment. So they'll be on Friday, the October 27th from 8:30 to 9:30 in the morning. And then another one on Monday, November 13th from 4 to 5 p.m. So again, we'll just be in Teams. You can drop by. We can work on whatever is helpful to you. And then in addition to those, the opportunities that you have to actually go to city council or go to county council and give public comment, we've got a couple more left at Seattle, both on October 27th at 10 a.m., just after that clinic, and then again on November 13th at 5 p.m. And for the county, there'll be opportunity on October 25th, November 8th, and November 22nd, all at 9:30 in the morning. And those dates are all posted on that website that Allison put in the chat as well. So lots of opportunities to engage. We have lots of resources to support you. And in addition to the resources that we have on the website, you can email me always. I'm happy to help. You can also check out the recording of our September general membership meeting. We did a training into how to give public comment, how to craft an effective message. We heard fantastic examples from folks who have given public comment before. So all of that is on our YouTube channel online, and you can check that out from our September general membership meeting. And I think, go ahead.
Oh, I was just going to say, Hallie, if anybody's, wow, I'm getting a great sunshine effect here. If anybody is not sure about which date they're available, or we didn't quite figure out how to put the clinic sign up in place, just go to that link and sign yourself up, and Hallie can follow up with you. It is for Seattle and King County advocacy. There are, just logistical issues. So for example, in Seattle, the sign up to give public comment opens 2 hours before the meeting begins. So if the meeting's at 10 a.m., you have to get online and sign yourself up at 8 a.m. if that doesn't work for you, we can sign you up. We can talk to you about whether or not you want to give comment. And if you give us, the correct information, we'll sign you up. And then you'll get an email explaining how to log in. So it's all manageable. And if you just sign yourself up on that website, we will, Hallie will follow up with you and we'll help make it happen.
Awesome. And if Jody, if we have a couple minutes more for this section, I'd love to share just a really fantastic example of public comment for just a couple minutes. Do we have time?
Please do, yes.
Awesome. Yeah, so I'd love to share a clip from a budget committee meeting a couple weeks ago from Josh, who works at New Horizons. So I'm going to go ahead and share my screen and holler if you can't hear the sound when I start playing.
My name is Josh Lodish, and I'm a case manager at New Horizons in Seattle, working to house and support young adults experiencing homelessness. I'm here today to speak in favor of wage equity for human service workers, and I'm grateful for the current wage increase work. I live and work in City Council District 7. Wage equity is important because the current low wages of human service workers harms both service workers and, importantly, clients in need of support. Every organization I work with, from housing to mental health care, is understaffed, almost entirely because wages are not high enough to attract workers. One example out of countless illustrates the harm this causes to clients. Formerly homeless young adult living in a permanent supportive housing program needed to switch into an ADA unit. For the past year, despite being required to have supportive services, no case managers have worked at this young adult's housing program. The young adult was not able to speak to anyone in their housing program to get their needs met, so they came to New Horizons to ask for assistance. I'm only contracted to work with folks experiencing homelessness, so although I offer this young adult assistance, it was on top of my current caseload, which is about 35 clients. This client experience demonstrates the consistent lack of services folks in need receive due to staffing shortages, as well as the burden staffing shortages create for already overburdened service workers like myself. By paying human service workers more, we ensure consistent staffing, which benefits both workers and clients alike. I urge the Mayor and City Council to work together to identify sustainable human service funding that achieves the recommended 7% wage increase by 2025. Thank you so much.
So that was just a really great example. I think Josh did a great job of, speaking from his experience and really demonstrating the need to raise human services wages and make sure that we get those inflation adjustments across the whole system. So just wanted to give that example to hopefully get you excited about giving public comment, get you excited about being engaged, and also show that anybody can really can do that and to speak from your experience. So hopefully that makes it feel a little bit more accessible. And please always feel free to send me an email, of course, if you have any questions. And I think with that, we are going to our presenter. Is that right, Jody?
Yeah, thank you, Hallie. I'm just gonna chime in with Hallie as my colleague. Like when I joined the coalition, I also was new to public comment, and I have benefited greatly from colleagues, Allison, previous colleagues, you all who do this work brilliantly, and I get to listen in like as mentors, as examples. Now, 2 years down the road, I am so passionate and committed about it, especially as also a Burien of resident and quite unhappy with what's happening in that arena and the city council that only partially represents my values and views. Of pulling back and really not really bringing in those lessons of like how to be passionate, how to really be effective, and I still lean on Allison, to be like, I'm going to public comment tonight as a resident. Can you help me tweak my comments? So it's a journey and we're in it together. And I invite you into this really cool space because we are really in this together. We are going to transition. We have Cassidy Thorne from Disability Empowerment Center joining by phone. And I just want to say, this is such a great example of the tenacity and the persistence with which the coalition is made up of, right? We do not give up easily, whether it's budget advocacy, bad policy, or we just want to bring you good information. We are gonna work to make it happen. So Cassidy, I just want to welcome you, but also extend a huge amount of gratitude for hanging in there with us and joining us by phone. I'm going to hand the floor to you, and we recognize you might have a little bit of an adjustment given that your tech is going on, has been struggling. So you let us know how we can support you. But thank you so much for being here and welcome.
Cassidy, we see that you're unmuted, but we can't hear you.
How about now?
We hear you now. Blessed be. Take it away.
Oh my goodness. Great. I thank you all so much for being patient and flexible. Tech issues are still happening. My video is not working, but we got the audio going. So I'm very excited to tell you all about our organization, what it is that we do, who we are, what we're based on, and answer any questions y'all might have. So can y'all see my screen okay? Beautiful. So I'm going to start with some statistics just to really bring the point home that people with disabilities make up a huge amount of the unhoused population. Every intersectionality, really. Disability is one of those things that knows no bounds and impacts every intersectionality. So our first stat is that 1 billion, that's billion with a B, people worldwide live with some form of a disability. And that comes from the World Health Organization. And nearly everyone is likely to experience a disability at some point in life, whether they're born with that disability, they age into it, or something occurs throughout their lifetime. And to bring it home, in our region, 1 in 5 people have a documented disability. And I want to reiterate that that's a documented disability. Here at Disability Empowerment Center, I'm probably going to mention this again, we do not require official diagnoses or any proof to work with us because we understand that there are barriers that exist in our medical system that might prevent people from getting that official diagnoses. So the number is probably higher than 1 in 5 in our region, but this is the stat we're working with from the CDC. So why we exist? We work to continue the justice work that people have started long ago. Before the 1960s, institutionalization of people with disabilities was widespread. It was the norm. The common phrase I use is out of sight, out of mind. So instead of integrating people into the community, they put them on the outskirts in an institution that was abhorrent. It took away autonomy and choice from these people. They were forced to live in this setting, live by those rules, and there still is a lot of institutionalization that happens today. Thankfully, it's not the norm, quote unquote, anymore, but it still occurs, and we do a lot of work to prevent that and to move people out of where they are institutionalized into their living situation of choice, whatever that might be. And I think y'all know this last point. People with disabilities continue to face discrimination, obstacles to employment, prejudice, and other unfair challenges. All of that fits under the umbrella of that big ism, ableism. So we recently went through a huge rebranding and name change. You might have heard of us and just don't realize we went through a name change. We were formerly the Alliance of People with Disabilities. Before that, we had another name, Washington Coalition of People with Disabilities. And funny story that I always like to share, they originally changed it to Alliance so that it would show up first in the phone book. We really wanted to go through a rebranding to show the community who we are, let it be known what we do. And it's made a huge impact on when people Google disability resources, we're the first thing to pop up. And before that, no one knew who we are or that we even existed. So please continue spreading the word. Disability Empowerment Center. We are here. We have 3 locations, and I'll let you know how to refer people to us or how you yourself can get connected later on. So who we empower, who we work alongside, everyone is welcome. If you live in King County, if you're 14 or older, and one really cool thing about us is we're the only cross-disability organization in King County. And that means we don't just focus on a or a couple disabilities. If you identify as having a disability, physical, intellectual, sensory, neurological, or whatever else it might be, we work alongside you to help you reach your goals. This is my favorite slide to talk about. We have Centers for Independent Living have a really unique model. The first bullet point, our staff and volunteers have disabilities too. Through the Rehabilitation Act, centers were created and mandated to be in every state. And we're also mandated to employ at least 51% people with disabilities on our staff, our leadership, and our board. We are currently at 100% at staff, 100% leadership, and 88% board. So we want to not just work alongside the disability community, we want to represent the disability community. And we work peer-to-peer, and having disabilities allows us to do that. So instead of coming in and having a case manager perspective where we're dictating what needs to get done for you to meet the, again, quote unquote, norm of society, you come in and set your own goals. And as a peer who has been there and experienced ableism, has experienced the obstacles and barriers you might be experiencing, we get to meet you where you're at and say, yeah, it sucks. We've been there too, and here's what's worked for us. And if it doesn't work for you, let's brainstorm and problem solve other solutions. And people we serve make all of their own choices. Again, institutionalization took away autonomy and choice. Society takes away autonomy and choice from people with disabilities. So we work really hard to undo that damage that's done. So when people come to us, they set their own goals. And again, I talked about deinstitutionalization, but they might want to live with roommates. They might want to move into their family's house. And so whatever their goals are, as far as housing, as far as independent living skills, we work alongside them and empower them to reach their goals that they have set for themselves. And we find that to be really empowering in itself, to give that choice, to say, hey, what do you want your life to look like? What is it that brings you joy, and how can we instill that? So what we do, overall, we work for people and we work for change. We have free individualized services. Yes, all of our services are free. And our big ones are noted on the left-hand side. So we have one-on-one skills training, and we also call that independent living skills training. And what that is a participant will come in, establish those goals that we've talked about, and they'll work alongside their independent living specialist to create a roadmap on how to reach those goals. And during sessions together, we can meet up to once a week for an hour or as little as once a month, again, depending on what the participant wants. And we work to knock out those action steps, to problem solve barriers and obstacles that are preventing them from meeting their goals, to celebrate successes and establish new goals as well. So we keep the ball rolling. We have several peer support groups. Again, peer mentoring is a huge part of who we are and what we do because, like I've said, we've been there, we've been through it, we've done it. So we have a few peer support groups in the works right now. We have Healthy Community Living, which is a 10-week course that goes over the basics of what you need to reach your goals. And within that 10 weeks, we encourage people to set at least one goal and see how much progress they can make in that time. And our team does the same thing. We establish goals right alongside our participants. We discuss our barriers and obstacles. We model what it's like that it's not a straight path to reaching your goals. It's kind of like a roller coaster. So they get that peer support and saying, oh, wow, even the person teaching me or working alongside me to reach my goals experiences barriers and obstacles too. And they see it modeled how we navigate that. And a big one we do is resource and referrals. I like to call it 211 with some follow-up. So people call us and might just need to get pointed in the right direction if our services aren't a good fit, whether that's another organization or a coalition like this. We might say, hey, this is a great resource for you. And instead of leaving it there, we follow up a week or two later and say, hey, how did that resource work out? And if it didn't, because as we know, many organizations, especially when it comes to housing, do not have a good callback time. So if that one didn't work, we send them in another direction. And if they want to come on at any point and get more support and come on as a participant, they are welcome to. And then on the right-hand side is our behind the scenes. So we're creating systems for change. We do policy and programs advocacy. Our executive director works with the King County Disability Consortium. She established alongside Robin Tutsuda at ARC of King County, the King County Disability Consortium. It's about 40 organizations that come together monthly to discuss what's going on in society and problem solve. They often bring in guest speakers who are looking for a disability lens, and they work really hard to keep that ball rolling beyond COVID. It was originally established when quarantine started to make sure everything that came out was accessible to the disability community, because it wasn't. And they want to continue the work that they started. I invite any of you to join the King County Disability Consortium if it's something you're interested in, to bring in a lens from the homeless community. Please let me know if you're interested. My contact information is at the very end. And we do disability consulting for businesses as well. So we go out, and I like to call it beyond the ADA. So we'll go in and do an ADA assessment, and then we also give tips for how to make it accessible to all. And really, accessibility benefits everyone, not just people with disabilities. One of my coworkers, Maria, she has this powerful image. It's like a cartoon strip. And I'm sorry for the visual description of it. I can send it out after. But it is a schoolyard, and it had snowed, and there's someone shoveling the front steps. And next to the steps, there's a ramp that isn't shoveled. And a wheelchair user asked them, can we shovel the ramp as well? He says, nope, the stairs are the most used. He said, but if we shoveled the ramp, everyone could use it. So just a great little model about how accessibility can benefit everyone, to make everyone feel part of the community. And I'm going back to peer support groups for a minute. I realize I didn't get to mention all of them, and I want you guys, and I want to brag about them. They're incredible. We also have a RISE peer mentoring group. It stands for Resources, Information, Support, and Empowerment. And they meet once monthly to come together to work on a group goal. Last month it was budgeting. The previous month it was a creative project. This month it will be cooking. It is actually today. And next month will be a guided painting project. So there will be a take-home piece to it. And we also have EPIC that is launching this month. It stands for Empowering People and Community. And the goal of this group is really to get people in the community and of the community, not just living on the outskirts because it's inaccessible to them. They're going to be going to the aquarium this month. We got some tickets donated, so it's free of cost, as with all of our services. to explore, to talk about accessibility issues that may have popped up. And what's really great about this group is we teach independent living skills through it. So there's a transportation component as far as public transportation goes, how to get from where you are to where we're going to be. There's a social impact to it. It's something that has been asked for by participants, and we're really excited that it's come to life. And then we also have an older adult peer support group that meets in North Seattle once a quarter, and it's mutual aid based. So they define the issues in their community and they problem solve together to think of how to solve those issues, or at least decrease the barriers that are identified. Youth transition services. I'm going to focus on all of our transition services, but youth is transitioning into adulthood can be hard, you guys, and we're here to help. So we have those one-on-one skills training. We have our monthly peer mentoring group. We teach advocacy skills to all. There's a summer workshop that takes place annually and a youth leadership forum that takes place in Washington State. So the things that we help with, and I'm going to focus mostly on housing referrals. And the bummer news, spoiler alert, is we don't provide housing. We are mandated by the Rehabilitation Act to not. But what we can do is assist in filling out those sometimes hard to interpret applications. We can assist with follow-up. We can point them in the right direction. We can provide support during that waiting process. And we can help identify shelters for the interim. And sometimes it's proposing other solutions, like, have you thought about roommates? What other people do you have in the area? So although it's not ideal, we work within the system we have, and that's it. We can help with utility assistance, not in the form of paying them, but in the form of identifying other resources. And again, assisting with those applications, ensuring everything is in order, being that second set of eyes. Transitioning to independent living, similar to what we just talked about with youth, it can be hard to go from living in an institution, whether that be a shelter, whether that be a hospital or an adult family home. You might not have all the skills you need to live independently, cooking, budgeting, cleaning, etc., all the things that go under that umbrella. And we teach those skills so that they can be successful in their new home, not just have a roof over their head, but have a home. Job search and resume writing. This is a big one. People come to us in need of employment services. And although we're not DVR, we don't do job coaching, we can do everything else. We can teach the skills to write resumes, cover letters, job searching, interviewing skills, and again, continue our relationship to problem solve the barriers that are popping up, because work can be tough. Transportation options. So we can help with applications for access. We can teach public transportation skills. We can help study for driver's license tests. Recreation and social activities. We have those peer mentoring groups, and we can also work one-on-one with someone. We had a participant who really wanted to go to a baseball game this year. We made it happen. We taught public transportation. We went to the game with them. It was a really good time, and to see them again, not just being in the community, but of the community. Assistive technology is the next one. We can help people identify what AT is needed for them to be successful. Hey, what's the problem you're experiencing? Have you heard of this? This might be a great tool. And we frequently reach out to WATOP, Washington Assistive Technology. Oh gosh, our world of acronyms. I can't remember them all. And they have a great program, like a lending library, where you can try it out before you make a purchase to see if it does meet your needs. Healthcare and social services, navigating that world. Again, developing the skills you need to live independently, and other services. And why we include others, because we do it all. Whatever your goals may be, we work to help you reach them. And I've had some wild ones, but those are the fun ones. So how to access our services? It's really easy to do. We have a brand new fancy schmancy website that we're really proud of. Again, that came with our rebranding. That does a great job of kind of disseminating who we are and what we do. And there is a contact us section where people can just fill out an online submission form, check a couple boxes. It comes directly to me, and then I assign it to an independent living specialist. You can give us a call. And we have 3 centers in Seattle, Redmond, and Auburn. So we tried to strategically place our offices in places where we identified high need or unserved or underserved populations. But we can travel to people where they're at. Although we are not allowed to go into their house, we can meet them in the community, a coffee shop, library, a park across the street, wherever they're comfortable meeting, we can meet them where they're at if transportation is an obstacle for them, preventing them from getting our services. So how y'all can get involved? Again, please check out our new website. We are so proud of it. Hopefully you didn't see our previous website. That was If you did, I apologize, but this one we are very proud of. We do have a Facebook, LinkedIn, and YouTube. We have an e-newsletter that comes out quarterly. You can sign up for that on our website as well. You can donate to our mission vision. You can volunteer. We are currently starting our volunteer program and are really excited to get it going. We are actively looking for board members. Our board president just stepped down after 13 years. So we are sad to see him go, but he wants to move on to his next adventure in life, and we understand that. But we are looking for a board president, a board treasurer, and a couple other just board member positions. We can have up to 12. We currently have 6. So anyone and everyone, please feel to reach out to me. We are really excited to see our board grow and get some new perspectives to guide our work. You can also work for us. We are currently hiring. Don't leave your current positions, but if you know of anyone who is looking to do social work from the disability world, we are hiring independent living specialist positions at our Auburn office and our Redmond office. And what's really the most impactful, I think you'll already know this, I was able to pop in right before and I heard the tail end of a story that was being shared. Those are powerful. If you have a story where you've experienced obstacles or barriers due to your disability and the way our society is set up, please feel free to reach out to me and we can share it, because that's really what impacts change on the legislative level. Here is the front page of our new website. So when you're looking for it, this will be the front page so you know you got to the right place. Again, we're very proud of this. It took a long time and we're ready. We're so happy to see it in action and being used.
Cassidy. Oh, perfect. I was just going to say, I was going to have us transition to questions just so we have a little bit of time for questions, but it seems like you're there. So sorry to interrupt.
Perfect timing, Jody. So this is my contact information. I will also share it in the chat. So I can stop sharing my screen so we can all see each other. Well, I guess y'all can't see me, but so I can see you. Does anyone have any questions?
Well, while people are maybe formulating or typing, one, I want to just say thank you, Cassidy. That was really a wealth of information and wonderful services. And I'm super excited that we are going to be able to share this out in our blog. Karina, take it away.
Quick question, just because this is a disability I've been really struggling to find resources for. Do you have experience with chemical sensitivity?
We do. So, and we do. I'm currently working with a participant who experiences chemical sensitivity who is looking for housing. We've been able to get them some extensions as they continue their search through us teaching them how to advocate, drafting emails together, practicing conversations and how to prepare for them. Unfortunately, we don't have a secret back door to finding housing with chemical sensitivity, but we have found ways to get extensions through, again, it was really storytelling and describing the impact that it has. One of the things we're doing is advocating for more accessible housing, including chemical sensitivities. So we do work with people who experience that. I wish I had a quick fix, but I don't.
We actually just, we got an acceptance on an apartment. She's just really scared to, because of the market, right? She hasn't been in the specific apartment that she's going to be signing a year lease for. And so she's scared to sign a lease without being able to smell the apartment first. So that's been a challenge, but there's all kinds of challenges, and I will definitely refer her. Thank you so much.
Yes, and congrats on them getting a place, Karina. That's exciting. I hope it works out.
Thanks, Karina. Elizabeth.
Thank you. So I have a client who is a senior. He'll be 68 soon, I believe. And he is physically disabled and has other medical issues, but also would like to attain a GED. This client has dyslexia, and so I've been trying to find resources for a program that's kind of like a shadow or tutor program for him to attain this goal of his. But I've had like no results from the colleges. So I'm just curious if you know of any resources or if that's something that you guys provide at DEC.
Elizabeth, we have an incredible independent living specialist named Philip, who is currently working with a participant with cognitive disabilities, including dyslexia, and works with tutoring him. Now, he's not a trained tutor, but it's all about meeting people where they're at, finding what works. So that is a possibility. Please reach out to me, and I can do research on other resources that might be available. But it sounds like it could be a great fit as far as getting it started.
Yeah, fantastic. Thank you so much.
Of course, thank you.
Awesome. And Karina also just threw in a little GED through HopeLink. Allison, would you like to ask your question that you threw in the chat?
I would. Thank you, Cassidy. I add my appreciation. It's really helpful to hear the different ways that Disability Empowerment Center is structuring connecting with people. And it is so painfully true, not only that so many people experiencing homelessness live with one or more disabilities, whether or not they're officially named, but also that there's very little overlap between these worlds of service and advocacy. And I am just curious to know whether you currently have any established connections. One example that came to my mind was this idea of, you know, a group sort of like the mutual support groups that you described, meeting at, for example, a permanent supportive housing site or a day center. Does anything like that currently exist that you're aware of?
Oh, Allison, we go to Elizabeth Gregory Home. We go to Ballard Urban Rest Stop, Downtown Urban Rest Stop, Jubilee Women's Center. And what we do is, it's not like an outreach tabling event. We go there to have a presence in the community, sign people up as participants, and we essentially hold independent living skills training with them right there.
Awesome.
So yes, we're always looking for more places to do it. Again, like many nonprofits, we're a small staff, so we're going to be at capacity soon, but we are ever growing. So yes, and I can get you connected with them. We do have a contact at each site, and I would love to get you connected if that's something you're interested in doing as well.
I think it would be something that we want to share with people. You can perhaps see in the chat, you already got a response from Karina. So maybe the first step is for us to share with people the days and times that you are at those homeless servings, homeless specific sites, and maybe to clarify whether or not people who aren't necessarily Elizabeth Gregory House guests, whether or not people could come just on those days and connect with you. And then, yeah, let's think about it, because it just seems like such a natural, necessary, obvious additional piece. I will just note, I was in a meeting of the Permanent Supportive Housing Coalition yesterday, and among the things that PSH providers are trying desperately to do is to get occupational therapy as a covered service for the residents in their buildings. And it just seems to me like there's an extraordinarily important nexus here, and I'm very grateful to know more about what you all are doing in the community, and I bet we can collaborate and build on that.
So excited to do that. Yes. And if you share your email or shoot me an email, I don't have the dates off the top of my head for each location, but I'd be happy to share them and create a little blurb, maybe for our Facebook page that could be easily shared.
I feel confident that Tim and Jody will connect with you because I work for them.
Great.
Thank you.
Love that. Thank you, Allison.
Yeah, Cassidy, I was going to say, Tim and I will definitely connect. And I love the idea of a little blurb that we can share in our blog, that we can also potentially share on our Facebook. And I think having you here has been really lovely and wonderful. And I think, coalition staff brains are sparking with excitement at this opportunity and what you all offer. So thank you so much for being here with us. We really appreciate it. We have just a minute left, so I'm just gonna, if there's any community updates, announcements that anybody wants to share, I'm gonna go ahead and have somebody hit stop record.